Okay, thank you everyone for joining us. I think we have a bit of a quorum, so let's maybe start, and we want to be respectful of everyone's time. But thank you for joining the Dashboard's February office hours. These are meant to be small, hands-on, interactive sessions. So, throughout our presentation, if you have any questions, feel free to drop them in the chat or interrupt us, and we'll be happy to answer them at the end or on the go, whatever you prefer. My name is Samantha Breslin. I am the program coordinator for the Dashboard, and I'm joined today by Becky Ofron, who's our manager of engagement and partnerships. And we want to hear from you guys. So if you can just drop in the chat your name, the city you're from, the organization that you work for, and if you are a new Dashboard user or maybe you're more experienced, we'd love to learn that and learn more about you as well. And so while you guys do that, this month we'll be focusing on how the Dashboard can be a tool in your arsenal to identify racism and any structural barriers to health, but to also help you and support you as you begin to address these large challenges. And I do just want to start this session off and just say that, this is a safe space. We all come to this at, various levels. And I just want to make sure that we are all respectful, non-judgmental, and we come to this work with from a place of compassion, respect, and empathy. And as I said, your organizations are all in various phases on this anti-racism journey. And, the Dashboard team, our website, the resources that we provide, this webinar is here to support you no matter where you are. And so with that, we can get started. And so Becky, if you could just go to the next slide. Awesome. So at the City Health Dashboard, our goal is to help cities across the US leverage the power of data to support their community, improve the health of everyone in their community. And we created this tool with the ultimate purpose of supporting mayors, city leaders, health departments, as they, as they started prioritizing health and well-being. But when we started about 2 years or almost 3 years ago at this point, which is so crazy, most data on health and the drivers of health were not organized at the city or the neighborhood level, but rather at the county, the state, or the national level. And so we changed that for over 750 US cities. When we launched in 2018, we provided these data for 500 of the largest US cities, but this past spring, we were able to expand the reach of our tool to include all cities with a population of around 50,000 or higher, bringing our total to 766 cities across the country, which you can see here on this slide. And all of those dots represent cities. We developed the Dashboard by our internal team here at NYU School of Medicine, Department of Population Health, but also in close collaboration with the NYU Wagner School of Public Service, the National Resource Network, the National League of Cities, and ICMA. And in developing this tool, we worked very closely with city partners and city leaders on the ground, in our measure selection, in website development and user testing. And it was really important for us to get that on the ground feedback and perspective when we were designing the tool to make it, as easy to use as possible and, a one-stop shop for our users. And, this slide just kind of lays out who can use the Dashboard or who is our typical user. And there's a lot of diverse people that use the Dashboard. And we're always kind of finding new use cases, new sectors, new types of people who are coming to the Dashboard. But this is, our main users. And we designed the tool to be, and because our users are so diverse, we designed this tool to be pretty flexible, and that's why it's so powerful. But if there's, 3 ways that people can use the tool, it's to compare health gaps across neighborhoods and really dig into what could be causing those gaps. Users can, you could see actually, I want to call out on this slide, we've pulled out life expectancy in Columbus, Ohio. And these 3 neighborhoods that we've identified or census tracts are within a mile of each other, but residents living in each of these neighborhoods can have very different expectations for how long and how well they live. And, you know, when you come to the site, you're really able to see those differences and dig into what could be driving those differences. And Becky's going to get into some of that today. Users can compare their city to cities in other regions, cities with similar population size or demographic makeup. And users are really able to leverage the data on this site, leverage our maps, leverage our resources to help them set priorities and better target their resources towards those neighborhoods, towards those communities where those efforts will have the most impact and be most effective. And when we chose our measures, we provide over 37 of them. We applied a pretty rigorous criteria in which ones made it onto the dashboard. All of our data comes from national data sets. And I mention this because, you know, because these are national data sets, all of the data, you know, if you're looking at high school completion, for example, in Albany, New York, the way that's measured in Albany is the same way high school completion is measured in Sacramento, California, or Austin, Texas. So you're really comparing apples to apples. All of our measures reflect public health priorities and are amenable at the city level for intervention. Our tool would be, you know, useless if we presented all of this information and users couldn't kind of do anything with the data. So all of our data is really meant for users to take action and drive change. And finally, all of our data, all 37 of our measures are balanced over 5 domains: clinical care, health outcomes, the physical environment, social and economic factors, and health behavior. And the next slide shows all of our measures by these different categories. And the measures listed on this slide in blue are available at the city level, while the measures listed in yellow are available at both the city level and the neighborhood level. And so most of our measures are available at the neighborhood level. So you can really, again, dig into, you know, disparities across place and across neighborhoods. And now for the meat of the presentation, I will hand it over to Becky to walk us through how the tool can be used, again, in uncovering racism and structural barriers to health.
Great, thank you, Sammy. Everybody can hear me okay? Thumbs up, okay. So at the dashboard, you know, let me just move some stuff out of the way here. There's a lot of windows open. So if you're not familiar with the dashboard yet, we'll show a little bit of how it can be used. But as Sammy explained, it's really allows you to compare health data and those social drivers of health across many different cities, or really dig into your own city. So we'll cover a little bit of both of that. And the context is really that health outcomes can vary a lot across cities and across neighborhoods, reflecting the reality that some areas have been cut off from resources or opportunities more than others. And while there are a lot of ways to explore this, certainly community conversation and a city's history, and that is all, you know, a really important way to access, you know, what is driving some of these disparities. But data can also be helpful. And I just want to kind of start this with saying we know that data is also not the answer to everything, but it's the tool that we focus on and we think about every day. So, so we're presenting this as kind of one tool in the toolkit for really digging into how racism and equity affects health in your community. So as Sammy mentioned, the City Health Dashboard launched almost 3 years ago, and we're constantly thinking about ways of working with cities to use the data. And we're creating this new resource. It's like a way of walks you through exploring the data specifically with an equity lens. And so we can share the document with you after today's office hours, but I'm going to walk through a couple of things in the site to kind of explain some of that. So feel free to be putting things into the chat. We might get to it as we're talking, so we'll definitely get to questions later. And let's just dive in here. So when you go to the site, it's just cityhealthdashboard.com. And you just need an internet connection to get there. It's a totally free tool. And when you put in a city, we're going to explore Kalamazoo, Michigan today. And I realized as I was putting this together that our last office hours also focused on Kalamazoo. They happen to be one of the cities that we do a lot of work with, and they happen to be doing a lot of work around equity. So, so they're back as our example this week. So again, here's the list of measures as it shows up on the site, and you can certainly dive straight in, but we often recommend kind of starting with the city overview, which you can get to by clicking here at the bottom. And the reason I think it's good to start there is there's a metrics overview that shows all the different metrics and how the city is doing on each of those, but we also have these new demographic exploration features. And I wanted to make sure we touch on these today. I know we've covered it in past office hours as well, but you know, in understanding who makes up your city and where they live, this can be really helpful. So we have it in tabular form and also as a map. So I'm showing the table on the left and the map on the right that you would get to by clicking on this tab. So I'm cheating a little bit here with these screenshots, but so here I pulled up the population, the Hispanic population in Kalamazoo, and it maps it for you. And what's nice is we also have some really detailed subgroups for some of these. So for Asian, Native Hawaiian, and Pacific Islander, when the population is large enough, and Hispanic subgroups, we have really kind of by region, and you can get really detailed information there. But I just wanted to show the Hispanic population, and it just starts to give you a really good sense. You know, they make up 7% of the population in Kalamazoo, but they, you know, the group is really focused in certain areas of the city. So it can just help with planning, messaging, understanding what's happening in those neighborhoods. So then you can also click into the individual metrics, and here I've just selected children in poverty in Kalamazoo. And we'll walk through kind of what you'll see on the site again, but I've cheated a little bit with some screenshots to make it easier to dive into some of this here. So, you know, as soon as you get to a metric page, they all have a similar look. We have data from different years, so you can go back and check different years for many of the metrics and get more details about how we calculate the metric. You know, on the source for the data, as Sammy mentioned, we pull from national data sets, so primarily ACS. We do some calculations on national vital statistics data. We pull from CDC's Places, formerly known as 500 Cities Project. So a lot of different sources. So you can always click here to find out more about the metric that we're talking about. And this metric is from ACS specifically. And I'll just move forward here to kind of dive in. So the value here of the gold bar is the city value for children in poverty in Kalamazoo. And the value here with the little kind of blue caret is the average of all cities in the City Health Dashboard. So it's not quite a national average, but covering 766 cities. It gives you a sense of how your city compares to the average for this value across the other cities in the dashboard. Generally across the site, lighter colors indicate better outcomes, and this blue check mark also kind of is a signpost so that you can recognize that. So children in poverty, we obviously want lower values. For a measure like high school completion, we would want higher values, so the color bar will flip in that case. And then there's a little green check mark is present when the value for your city is better than the dashboard city average. So this gives you some interesting information. 34% of children in Kalamazoo are living in poverty. But as you scroll down from that city metric into the map is even more information. So we find out that 34% is actually a very large range by neighborhood, from 6 to 65%. So you can see here this census tract kind of in the southwest of the city is has only 6% children in poverty, and then this neighborhood up here has 65%. I don't know Kalamazoo that well. I imagine this is not that many miles in between, as Sammy kind of pointed out in the map of Columbus earlier in the slides. So now we're fleshing out even more kind of the dynamics of what's happening across the city. And for many of our measures, we also have them broken down by some other demographic factors. So race and ethnicity, sometimes we have them by gender or age. And this is where we start to see even more information. And this is kind of showing the importance of really disaggregated data and how important it is to be diving into the more granular data, and why state and sometimes even county data just is not enough. So here we're looking at children in poverty across the different race and ethnic groups in Kalamazoo. And I've included here, which is on the site, the proportion of the population that includes that racial and ethnic group, which is important information also. So we see that 43% of the child population is white, 32% is Black, but poverty is not equal, shared equally across these groups. And so, looking at the neighborhoods, looking at the racial and ethnic makeup is really important to start to understand what these differences are across the city, and how different policies and programs that you're working on can best be implemented in a way that really targets the population that you want to help. And one thing that we've kind of built into the Data Explorer resource that we've been preparing, is understanding the background and history of why some things turn out this way. And I know redlining is often shared as an example, but it's a pretty powerful one, especially when you're looking at the map. So I wanted to pull this up. If you've not seen the Mapping Inequality Project out of University of Richmond, it's pretty amazing. They've pulled together all the old redlining maps, so you can just search for your city and find it. And I hope everybody's familiar with what redlining was, but they essentially divided up cities by areas that were considered best, still desirable, definitely declining, or hazardous. And this was essentially based on immigrant and Black populations. And so Kalamazoo has their map there, and there's different ways that you can explore it. So I definitely recommend doing that, and the link is in the resource that we provide as well. And so I just wanted to keep that same map here and now show the demographic map of Kalamazoo for Black populations. And it's pretty telling that the current spread of where Black communities live in the city is certainly connected to where they were restricted to living back in the 1940s. So I know Kalamazoo is doing a lot of deep work on this, both within city government, county government, and with community groups. And I think it's important to address not just one systemic issue from history, but really understanding all the different ways that health is being impacted by racism. And I just wanted to, there's different ways of describing structural racism, but we actually had a lecture from a professor at NYU, Crystal Lewis, last week, and she described it as stolen opportunities to build wealth. And I just felt like that was really connected to what we're seeing in terms of health outcomes, and how the social determinants of health are really ingrained in what we're seeing in other health outcomes. And as much as racism and segregation and how we treat immigrants may be thought of as history, when you look at it in the grand scheme of our country here, it is still certainly alive and present today. So then thinking about how to put data into action, and I really kind of gleaned over, there's many ways to use the site, and I can pull it up after the presentation as we're going through questions to show a little bit more. But we also have a take action section, and You know, we don't want to just present data to you and say, good luck. Here are areas where you're doing great, and here are areas that your city could improve. But we provide tools that you can also use. And I think Kalamazoo has some good examples of ways that they are confronting kind of their history and ways to improve equity. They, Western Michigan University, which is based in Kalamazoo, hosts an annual health equity summit. And in 2019, it had a historic lens. And one of the students there said the issues that we're talking about in the summit are things that are systemic in nature and things that have started that way and have continued to be propagated or reinforced by systemic racism and decisions. And just the fact that they're bringing together, you know, the university, but also other community stakeholders and businesses, I think is just a great way to really start putting the work into action. And then just this past year, in June 2020, the Kalamazoo County Commissioners voted on some proclamations declaring racism a public health crisis and an end to police brutality. And it was interesting during this discussion, one of the commissioners questioned why the board would add racism to the long list of the health department's responsibilities. And before reading the public health crisis proclamation, another commissioner pointed to the county's data hub, so some data that the county produces on their own, which shows that the racial disparities in categories ranging from childhood obesity to infant mortality really require them to be facing racism head on. And the proclamation there specifically addresses the health disparities revealed by the COVID-19 data there as well. So, you know, it's just, this is showing a couple of ways that you can put data into action. We have some other resources on the site that help give language around exploring racism and the health disparities, but we want to, you know, just give various ways of approaching it and using tools to do that. So again, this is the worksheet. These are the, right now we have it as like a Word worksheet. It feels a little old school that way. And there might be easier ways to share it as like slides, especially for this virtual world, since we're not always sitting down around a meeting table together to work on something like that. But this is just sort of the outline again, walking you through the demographic makeup of your city, using the data on the dashboard to start to understand, you know, what's driving some of the disparities that you might be seeing, ways of comparing to other cities, bringing in that historical context through the redlining maps, and then working into some steps to put it into action. And then also thinking about integrating other data and what are the data gaps. You know, we're one site that provides city level data. There's certainly other county health rankings and other tools that and local data that you can be incorporating. So we give some steps to think about, you know, ways of integrating some of those other data tools as well. So we're going to stop there kind of with the formal presentation. Hopefully it gave you enough to kind of start thinking about, and if you have questions, I'm happy to actually just pull up the site here instead of just using screenshots. I had the take action section open here just to show you, and you get to that just from the menu here on the left, going to take action. We have policies and programs, ways of finding partners, and especially in this exploring strategies section, we have a number of different things around racism and equity, developing kind of language and communication around it, but also some very actionable steps. Some general resources about finding funding and measuring impact and evaluation as well. So I'll just kind of go here to the home site and pause there to see if we have any questions. And it can be, you know, general questions about how to use the dashboard, or getting into some of these questions around equity as well. We're happy to talk about any of it. And also to hear from what might be working or some of the current challenges that you're dealing with in your communities too. So I'll pause there. I see there was a question about demographic detail earlier, and I think it was covered, but should I show how to get there?
Yeah, I think that would be helpful, Becky.
Okay. Okay, so I'll just pull it back because I saw somebody mention that one. So you scroll down here to the overview. You can also get to it. This ribbon at the top kind of walks you through the different sections of the site. So this is the city overview, which is just a quick snapshot of how your city is doing on all of the different measures. And again, you just know that you're doing better than the sort of national average if there's a green check mark. So there's all of those different measures. But up here at the top is the demographics overview is how you get to the tabular form here. And this is where you can dive into those smaller subgroups. And then the map version is here, the demographics by census tract. And first you have to pick the group that you're interested in looking at, and then it will populate on the map and show you where that population is.
And Becky, do you want to maybe just show where you can get the demographic detail for the metric?
Sure. So if you just move forward here on this bar again, metric detail. So here's children in poverty, again with kind of the standard view of just how the city is doing. You scroll down and see your map. You can kind of click around and discover what's going on in those different census tracts. And if you click on demographic detail here at the top, the next section on the bar there, it begins to show you this breakdown. And again, we don't have demographic breakdowns for every measure, but for 2/3, is that right?
1/3.
1/3 of the measures, we have demographic breakdowns. And again, sometimes it varies what is available. Sometimes there's also gender available. There's some different age groups, things like that. So that's where the demographic breakdowns are. And we'll also just mention that all of our data is downloadable. You can access the data here on the menu. Sometimes if it's the first time you're coming to this, there's a little form that pops up for you to just fill out so that we can kind of keep track of data downloaders in case we have specific updates. But you can download CSV files for all of the cities or just get them by state, and that will have all the cities in each state. Or we also have an API if you need to access certain things more easily and kind of build it into other work that you're doing.
And we got a question about from Michael. If you want to see the data on a specific metric for a single zip code rather than seeing it in multiple census tracts within that zip code, is that possible for those metrics available at the city, at the neighborhood level? So that is a great question and one that we've grappled with a bit. So as you mentioned, you can put in the zip code that you're interested in exploring in the that little search bar, I don't know the zip codes of Asheville, but you know, for my zip code in Brooklyn, I could kind of enter 11249, and it'll pull up all of the different census tracts that belong to that zip code on the side there where Becky on the side of the right side of the map where Becky's cursor is. We also, as Becky is showing us, we have a table that has all of the zip codes and census tract numbers and their various values. Alex, who is our data analyst, do you have anything to add there? I'm sure there's something I'm missing.
Sure. Thanks, Sammy. That's a really great overview. If you're trying to add more information, like to aggregate or combine different census tracts into the single zip code, and have some more data savvy, one way that you could work around this and get zip code values is to use what's called a crosswalk, which will allow you to transform the census tract values to the corresponding zip code. We unfortunately provide that information, but there are a variety of tracked to zip code crosswalks available from the census.
Yeah, and just to add to that, I know that in some more rural, so census tracts are really our kind of smallest building block on the dashboard, and in some more rural areas, census tracts can be quite large, and there might be multiple zip codes within them, but they don't nest together exactly. And then in some places like New York City, there's hundreds of census tracts in a single zip code, so it really varies based on population across the country too.
And Becky, we got a question about, are you able to add multiple metrics to view at a time? And the answer to that is yes, but I will let Becky walk you through that on her screen.
Yeah, so one way to do that is just to look at the city overview again, and you can expand and look at some, metrics that way, but we also have compare metrics. And this allows you to, let's see. So it allows you to choose two different measures and see how they move together. So they're not exactly correlated, but you can see on the map here. So we're still looking at children in poverty. Census tracts are in blue. And again, lighter indicates better outcomes. And I've added our COVID local risk index on top of that with their like pink and red dots. So let me just zoom in here a little bit to Asheville. And again, with the pink and red dots, lighter colors indicate better outcomes. So it's one way of kind of viewing how two measures move together across the city. And you can see some of those patterns pretty clearly here on the map. But then you can also view it as a scatter plot where each of these dots is a census tract, and you can kind of look at some outliers there and see what might be going on. So that's another way to view two measures together. If you, of course, download the data set, it's a CSV file, so you can, we're happy to, help because it's a pretty large CSV file with a lot of different columns, but that's another way that you can, begin to look at, especially if you're kind of zooming into specific census tracts and want to just see a few measures, that's certainly something you can do in Excel as well.
Thanks, Becky. And we also got a question if users can download or save the maps and other features on the site. That is the billion-dollar question, and one that we get quite a bit, and one a feature that we do not currently have on the site, but are actively working with our web developers to get onto the site. And I think we're at a point where we're launching that pretty imminently. We can't say when right now, but if you are not signed up for our newsletter or on our mailing list, please subscribe, because that's where you will get the updates that those features have been added. And so once those features are built into the site, there will be a button across some of like the maps and features that are here that'll say like download this image. In the meantime, we suggest using screenshots where you can. That's the easiest way to kind of download or get images from the site. But again, this is something that we're really, very much prioritizing, and we will have the capabilities to do this very, very soon.
Yeah, definitely within the next few months, I think we'll have ways that you can easily download both kind of this scale bar section as well as the maps. But we do encourage people to use graphics and data from the site, just cite that it's from the City Health dashboard, and we encourage you to put it into presentations and reports and anything like that. Other questions or examples of ways that you're exploring how to improve equity in your communities? I see a question here. I'm just going to read it. One of the projects I'm working on is supporting community health workers across Western North Carolina I really appreciate the COVID risk index and wonder if there are plans for including other COVID measures, cases, vaccinations, et cetera. So that's a great question. I'll just pull up the COVID local risk index here. So for those who haven't explored this yet, it's an index from 1 to 10, 10 being very, high risk of COVID spread and severity of infection, and 1 being low risk. And we developed this based on the CDC's social vulnerability index, factoring in some other important risk factors that weren't captured in that. And we are actually going to be updating this soon, but it will, still be an index from 1 to 10. And of course, if you are thinking about health in a community, everything changed 1 year ago, and COVID has shifted the way we think about many other factors of health, and certainly things like unemployment have changed. And so we also added, just show the metrics again here. So we added another more current unemployment value that is only lagged by, I think, 3 months or so on the site, because all of a sudden last year we realized that, a value of unemployment that is 2 years old is not going to be particularly helpful in this time of COVID. So we are working on some other measures that are more timely, but also very relevant to communities. I don't know that we have plans, and Alex, I can turn it over to you in a second here. I think there are a lot of places where you can get kind of cases and track vaccinations. They tend to be at the county level because there isn't currently like a reporting structure to collect that data directly from cities. Some cities do provide it. I know my city of Jersey City does. But in terms of covering all 766 cities, we don't have a place to get that at the city level. Alex, anything else you want to say about other COVID relevant measures?
Yeah, sure. Thanks, Becky. No, that's spot on. I think something that Dashboard has really grappled with on the data side would be really trying to find all of these COVID outcomes that Emma, that you bring up: cases, vaccinations, deaths, etc. And the main limitation is that it's based on state by state. All states report their information differently, and even down to the county level, even down to the city level. A lot of these are reported reported different ways. Different states and cities will will use different metrics to say how many cases are new each day. So, for example, in New York City, we use a 7-day rolling average. Other cities will do the tests that are reported positive for that day. Others will aggregate by 3 days. So it really is a challenge, and it's hard to compare apples to apples. Oftentimes it's like apples to a pear, sometimes apples to an orange. And I think, does make it challenging for not only us, but researchers across the country to really gain a sense of what's happening and the environment around it. So specifically with North Carolina, I would definitely look towards your health department for that data.
I will add, we're always on the lookout for new kind of national sources in particular of measures. And we welcome kind of input or tips for things to check out that are really important for community level change. So always feel free to reach out to us with ideas there too. Any other questions or things that we can walk through to make it easier for you to use the data? Just because we have a moment, and I didn't touch on this section, I will just cover compare cities really quickly. So, you know, unlike a lot of other data tools, what we really value is being able to compare across cities, and that's why we use those national data sets. So COVID risk is being measured the same way here as it is in Jersey City. And I'm not sure why we would compare Asheville and Jersey City, but you could. And the index is because it's 1 to 10. A lot of cities have an average of 5, but as you'll see, the cities also really vary by neighborhoods across the city as well. So while an average of 5 might be common in cities, you'll see that the neighborhoods really range from 1 to 10. So you can just search for a city that you would want to compare, or you can also filter by a number of different features. And this is one of the more kind of hidden features on the site that whenever we show it, people are kind of surprised and didn't realize that they could do this. But you can compare, find cities that are in a similar population range. Again, we are now in Jersey City, looking at a measure in Jersey City. So I can pull up cities that have a similar population range. Maybe they have a similar proportion of Black residents. And you might get a surprising list of kind of peer cities to consider there. So maybe you want to look at Orlando and Pittsburgh, Pennsylvania. And again, we're looking at the risk index, which doesn't show quite the full variation. I'll just go back to children in poverty here so we can get a sense. So those cities remain listed when you change metrics, and you can see how you're doing compared to other places. And we have the demographic breakdowns for those as well. Another Jersey City person. Hello, Paul. So if no other questions, so you can always reach out to us at the info@cityhealthdashboard.com. That's not a generic email that sits for weeks. It goes right to Sammy. So she will answer your question or send it to somebody on the team. And as she mentioned, you can subscribe on the site here. Just go down here to subscribe. We're going to be having a data update coming pretty soon. So you'll hear about that first if you're on our newsletter list. And anything else important I see Paul's question. Are you able to add multiple metrics to view? So the best way that we have that is just the comparing metrics. So you can look at 2 metrics at the same time. Otherwise, just kind of getting the overview from the city overview of how you're doing on all the metrics, or pulling it from the downloadable CSV file. Great. So thank you for joining. We do record these, so we'll post it back on the Virtual Office Hours webpage, so you can always return to it. We'll hang out here for another few minutes if someone shy has a question that they want to ask as the group gets a little smaller, but we're always happy to engage on questions around the data or the site, so you can always email us as well. Sammy, anything else to wrap up?
I think that covers it. Thanks, Becky.
Okay, thanks everyone.
Hi, Paul. I see you just asked a question in the chat about a metric for trauma. We do not have a metric specific to trauma. We do have a measure of frequent physical distress. I'm not sure if that's kind of in the same ballpark of what you're talking about. That is kind of like actually, I should probably pull that up. It's a totalizing measure about physical distress, not really specifically focused on trauma, but maybe trauma is in that. We also have a measure of frequent mental distress. Again, might not be exactly what you're looking for, but could help get at that issue. I don't know. Alex would have a better sense of. I don't think we have explored measures of trauma for the dashboard, but as we've kind of mentioned, we're limited by the fact that we do have so many cities. So the data set that we provide or that we kind of present and use needs to cover most of those cities, if not all. Be available hopefully at the neighborhood level where possible, and be from a national data set. So we're able, again, to compare apples to apples across each of the different cities.
And just adding, hi, this is Shoshana Levine. I'm the program director for the dashboard. We've talked about and thought a lot about a measure of ACEs, so adverse childhood events, which is kind of gets to a lot of different aspects of trauma, as you're noting there, Paul. As Sammy mentioned, our biggest issue is finding a good data set. So if you have any thoughts on data sets that would have the data the right level of granularity, would love to discuss this more. It's definitely something that's on our radar, but that we've had trouble kind of really pinning down the right measure.
Any other questions?
Okay, I think we can go ahead and close it up. Thanks, everybody. Thanks, Sammy.
Thanks. Have a good day, all.